We have to get back to nature. The more healthy and natural products we eat, the healthier we become. Hello, this is Terry Bell with another edition of Herb Doc. Hello, this is Terry Bell with another edition of Herb Doc. Today, just in the nick of time, this guy showed up. His name is Nick, and we're glad to have him here. Thank you for coming on my show.
What a pleasure. Thank you for inviting me on.
You tell us, what is your title?
Well, my background is for 20 years I've practiced natural medicine in Saskatchewan. I was a registered massage therapist, still am in Saskatchewan. Past president of the Saskatchewan Association of Doctors of Natural Medicine. My background in there is really in homeopathic medicine. We do a lot of supplements, we do a lot of orthotic therapy for your shoes, that type of thing. Really looking at functional medicine, making sure all aspects is addressed, looked at, and health is improved. That's the bottom line.
You have the title a doctor. Do you use it? Because I never hear it. They just say
no.
Nick.
I tend to check my ego at the door. You know, most people.
Yeah.
Yeah. No, I just go by Nick. I just practice natural medicine. That's the way I tend to roll.
And where are you out of?
In Kenora is where my clinic has been for the last 20 years.
Kenora,
Saskatchewan.
Saskatchewan, because there is an Ontario, Kenora.
There is, yeah. Ours is East Central Saskatchewan. Ours is spelt with the CA as opposed to the KE.
So you've been around there about 20 years?
Yes, since 1997, 96 is when I started my practice. I first started in the medical clinic with the MDs in town. And then after a few years, just needed to grow, expand. I was hiring other therapists, so I needed my own space. So took on a clinic by myself and brought in other people. And over the last 20 years, I've had quite a few different healthcare practitioners, therapists, even nurses with foot care coming through the clinic and offering services.
Oh, okay. Is there more than one type of, like orthotics? What type do you do? There's more than one type.
There's all kinds, yes. No, we do prescription foot orthotics. We'll even do shoes, sandals with orthotics built in them.
So what do you take, a mold or you?
We will do 3D foam casting. We'll also do what's called a gait analysis, which is a pressure plate where they go walking across that so we can see a dynamic movement of the foot, where we can see the timing of the bones, the pressure on each bone, and what's the manner of the walk, the gait, see if there's any impairment in that.
Oh, yeah, because orthotics are really important.
Oh, significant.
Because if your frame isn't on, you're not on. The whole body is starting to...
Right. It's no different than your car. If your wheels aren't aligned or your tires aren't balanced, everything is going to wear out prematurely. Your suspension, everything, right? Nothing functions properly.
Well, it is like a car.
Sure.
If you don't look after it,
right.
the bumper sags, the rear end drags, your backfires.
Exactly.
Stuff like that.
Right.
And right here, you said a massage too. There's piles of types of massages.
Yeah, what I've done is, even from my background, my mother was a massage therapist and a reflexologist as well. And so that kind of really led me into more of a natural type of style of medicine, right? On the opposite end of the spectrum, my father was a nursing orderly in the hospital, so I had kind of both avenues of care, right?
Yes.
And so looking at natural medicine just made so much sense when I've seen the results people have and have had and continue to have, right? When we look at things rationally, I'm one who strongly believes in independent thought. And I think that too many are, even in universities and colleges, we're so trained to think within the realms of this bunch of knowledge or this spectrum of knowledge and not to expand and look elsewhere. And I think natural medicine really, that's what attracted me to it more so than going in for an MD or going in for other types of medicine.
Also, what is homeopathic?
Well, homeopathic medicine is a style of medicine that's originated a couple hundred years back. It was actually started by an MD when at the time Dr. Samuel Hahnemann, who at the time in Germany realized that his treatments as an MD was killing more people than the diseases they had themselves, right? So he recognized at that time kind of the body's healing force, right? They weren't quite sure how and what was going on, but he understood the concept that the body has an amazing ability to heal itself. We shouldn't be draining everybody of their blood and bloodletting and thinking that we're gaining any ground here, right? And so he says, we really have to address this. And when we look back at some of his teachings, we can see that fresh water, fresh air, fresh exercise, all of these things were mandates of his care. But homeopathy simply means like cures like. And some will even refer to it as the origin of vaccinations, albeit vaccinations may have gone astray since that point. But a very small amount of some substance can stimulate an immune response, whereas a very large amount will suppress an immune response. Right? So when we look at vaccinations today, they give you a very, 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 very small amount of a potentially dangerous substance, but that stimulates an immune response. I'm just not too much in agreement with the aluminums and formaldehydes and everything else that's currently in our vaccines, but that concept still can be dated back to Samuel Hahnemann and homeopathy, where very small amounts of something can stimulate an immune response.
Oh, okay. Like I said about herbal medicine, what is it? Like a liquid, a pill?
Homeopathic medicines, they come in various forms. You can get anything from pills, drops, there's even injections through Germany, through Europe. They use homeopathic injections, IV drips. You can have topical applications. It's no different than what you would look at as far as a medical stream today, as far as their options in treatments.
I'm just today here with Nick, and he's from Kenora, Saskatchewan. If you want to look him up, his phone number will be along the bottom of the screen. You can see it there right now. And we'll be back in a few minutes after this commercial. Thank you. Hello, my name is Terry Bell, and I'm going to tell you about a nice, wonderful product that I found. This product I took and I give it out to people just to get rid of it. And they would come back in a few months and said, I can't believe how good I digest food now. A lot of people with heartburn, you can get puffed, bloated, gastric, burping, farting, may lead to constipation or diarrhea. If you have a digestive problem, and what is in this little product, you're hearing about probiotics all the time, and they cost hundreds of dollars, 60, 70 bucks a month. Over the year, it's going to cost hundreds. This one is very cheap. For a month, about $17. Don't have to refrigerate. You just keep it in the bottle with a meal twice a day. You have heartburn that never quits, you need this product. In fact, we were brought up Mennonite, and if you ever let gas go in church, we had to sit in our own pew. So you know what I'm talking about. Gas is horrible. I even had a customer that came in that every time she walked, she would let gas go. After being on that product for a little while, she said, I can't believe the first month I seemed to get more, and then it disappeared. And what it does, it makes you digest all your products. There's a prebiotic in there, a probiotic, acidophilus, bifidophilus, and friendly bacteria. They're all in one. You don't have to spend a fortune to get well, just 2 capsules a day. See your Sho-Tai practitioner in your area. Look them up, Sho-Tai practitioner, or Google Terry Bell, and they'll tell you who's near you. You can pick those up. Thank you very much, and I hope you have a good meal tonight. Hello, Terry Bell here once again from Herb Doc, and I'm with Nick from Kenora, Saskatchewan. And I'm going to ask him about some products that really impressed me when I seen him. He's also attended some of my classes, so I know I go everywhere to find out everything about anything to do with your health. I don't care what it is, and I notice he does the same. I want the customer to, when they come to my place, even if I have to refer them to some place, they know they're going to get the treatment what they need. And the one here was very amazing. It's called My Pain Liniment. And tell me about that, first of all.
Well, that I consider one of my personal greatest accomplishment so far. Ideal in pain and pain management clinically, and that's ultimately what we've done for 20 years is pain management. And it's such a big, broad base, right? Everyone at some point is going to experience pain, right? If you don't have pain, check your pulse, make sure you're still kind of still going, right? But ultimately, we've always struggled in pain management when it comes to topical applications. So as far as being a therapist in that aspect, when we deal with pain, we often have inflammation, we often have many of these different things that even we can stir up as we work with them, right? So clinically, we've used all kinds of different applications. We've used cold applications. You know, there's a lot of rubs and liniments that create heat, a lot of rubs and liniments that create cold. But ultimately, those are deemed as a counter-irritant. So what we mean by a counter-irritant is you have to understand the skin as a barrier. Nothing typically gets through the skin, right? Otherwise, we'd be pulling up infections all the time. But the skin blocks all of this from getting to a level that we would want to see it, right in the muscle, right in the joint where the cause of the pain is. So they're known as counter-irritants. So you put something on it, makes it feel hot or makes it feel cold. It's just playing with the nerves on the skin, distracting you from the pain and what's causing the pain. So now this is where I've spent years of research is on a compound known as dimethyl sulfoxide or DMSO. Now DMSO has been around since 1866 it was discovered. It's completely natural. It comes when you take a tree and you turn it into pulp. That liquid that the chunks of bark in the wood starts to float through as it breaks down the cellulose fibers, that liquid becomes DMSO, which means it's essentially rich in sulfur. Okay? Now DMSO has the ability, unlike anything else, to penetrate the skin. As soon as you put it on the skin, within seconds it's absorbed right into the muscle, right into the joint. It's right into the bloodstream, and it's one thing that can actually cross. And this is what makes it remarkable. Crosses the blood-brain barrier. Okay? So there's been a lot of different uses for DMSO over the years. But like I said, it's been around since 1866. It's certainly not a new substance, but it's starting to gain a lot of notoriety for its capabilities. Right? Now, number one, its capabilities in pain and pain management. As soon as you apply it, the results we've seen are remarkable. When the people say it's almost instant, because when you put it on, it's instantly into the system. And what it's doing is a couple things. Number one is it's eliminating the firing of nerve fibers that stimulate pain. So it's going to stop pain right at the level there. The next thing it's going to do is get right into the muscle, right into the joint. It's actually also going to improve the blood flow, which is going to help promote healing. And the biggest thing that we will find when we do any research is its antioxidant capabilities. Now, what that means is you have to understand with inflammation, free radicals are there in large amounts. And so when we use something along this line with the DMSO, DMSO acts as an antioxidant, eliminating those free radicals of inflammation. So really those 4 key points is something that there's nothing else in the world that has the capability of DMSO in treating pain and pain management. Even when we look at arthritis, rheumatoid arthritis, it's huge because this can get right into the joint. And we have to understand sulfur is one of its, the dimethyl sulfoxide, rich in sulfur. Sulfur is one of the main elements within the body that's required. And it's required for collagen growth, for our joints, cartilage growth, hairs, nails, all of these things require sulfur. And so it's interesting when arthritic patients use it, just the look on their face within seconds is quite remarkable. And this is something we've worked for quite some time just to even get approved by Health Canada. I know in a lot of different countries, dimethyl sulfoxide has been used successfully for many years, in Europe and Russia where it was discovered. I know in the United States right now, DMSO is not for pain or pain management. They have it approved for different uses. So there's been a huge market in the States for a pain and pain management DMSO, but that's something that'll come in time. In the States, what they've been using it for is a condition known as interstitial cystitis, which is a painful bladder condition. Right? The other treatment available is chemotherapy drugs or they will inject DMSO right into the bladder. And simple and effective treatment. And another interesting fact with DMSO, just to demonstrate its capabilities, is how yet in the 60s in the States, it was used for organ donors. So when they would remove, take for example, a kidney, I don't know if you're a hunter or not, but you know, when we start to clean an animal, you can see the kidneys and the organs, they dry up very, very quickly. And so when you're dealing with an organ donor and you're removing a healthy organ, we want that to remain healthy until it gets into its recipient. So DMSO is actually a part of that little bath that the organ will go into till it gets to the recipient, because the DMSO penetrates all cells and it keeps that organ hydrated. So that's something they've used since the 60s in the States and for those other conditions. But for pain and pain management in the States, it's only approved for veterinarian use. So people call their vets and say, yeah, I got a bad horse with a hip at home and or a bad hip and we need the DMSO. So it's been unfortunate in the States that it's seen a lot of the struggles of becoming approved. But in Health Canada here, as of last year, we've got it approved for everybody to use. And it's really been an interesting ride in the last year.
I'll be right back after this commercial, but you wouldn't want to be phoning the vet for your wife if she had pain and say, I need something for the old dog.
No, no. Well, you know, I'm sure they do that. You know.
Or the old cow. But we'll be right back after this commercial. Herb Doc, Terry Bell. Hello, this is Terry from Herb Doc. I'd like to tell you, some days you don't even feel like yourself. You notice part of me seems like I'm not here. People make jokes like, quit while you're ahead. That's all you see here. And the person doesn't feel good, he feels empty inside. And I can tell you what it is. It's called essential minerals. There's a little bottle here, it's essential minerals. It's 10 times stronger than normal, so you only need 5-10 drops a day. Sometimes that'll last you a year, that bottle. Sometimes it'll last you 6 months, depends how hard you work on yourself. I found out about a thymus problem. And what is a thymus problem? When kids are born, their thymus is over 90. And you could stick a kid in an environment for 2 weeks, stick him into that environment, and he can learn a language in less than 2 weeks because he has to learn that. Some people said it took a month. So what if we could do that? That's because the thymus is open and it's full. Thymus starts to shrink, and you test your thymus. When I test mine, it's 5, 10, 15, 20, 19, 18. It's at 18%. That's quite high. That's smarter than the average person. It's usually at 9. They have a hard time to learn. I start taking this product, and it come up from 9 to 18. I noticed as I'm driving along, I'm remembering phone numbers from all over the place. Phone numbers, old addresses, names, and everything else, just from getting your thymus up. Start taking that mineral, and you feel better and better and better. You only need a dropper full a day. You'll feel better and better. Then instantly, you will start feeling you're back to normal again. Oh, there, that feels better. I feel like I'm myself again. That part of me is missing. When you don't feel like yourself, you're missing minerals. Grab some essential minerals. Terry Bell again with Herb Doc. I've got a young man. Well, he's younger than me, so he's got to be young. Young man from Kenora, Saskatchewan, Nick Martinuik, and he's a homeopath. We were just talking when we left about a little product called My Pain Liniment. Liniment.
Yeah.
My Pain Liniment. What a good name there.
Thank you.
But one of these bottles, I was just curious. That's a spray bottle. How many sprays could you get out of that?
Out of a bottle, you're typically going to get just about 300 sprays. So you're going to get a lot of usage out of it. And DMSO is really something best used sparingly.
Yes. On that product there, you know, what types of pain? There's a lot of pain.
There's a lot of pain.
Mechanical, there's muscle, there's organ gland, there's emotional pain.
Right. I can't fix a broken heart, though.
Oh, you can't?
No,
Okay.
no, you know. Now, the reality is what types of pain respond best is, let's look at musculoskeletal issues first, like tendinitis, sprains, strains, dealing with muscles, tendons, ligaments,
And that is a
joints.
big one.
That's big. Tendinitis is a huge one, too. And when we look at those types of things, it deals with all ages, right? It's not just the seniors with arthritic pain or that type of concern. We're dealing with a lot of professional athletes who have been using DMSO simply because of speed of recovery as well. So after working out, we do, have damage within the muscles, acid buildup. DMSO does help significantly in that recovery time, that speed of recovery. So for everybody from a professional athlete to those weekend warriors who decide to go downhill skiing for the first time in 10 years, right? Those types of soreness, muscle aches. But some of the things that I've seen have, what I should say is been completely unexpected. Take, for example, one individual with Parkinson's. With Parkinson's disease, it's a degenerative disease involving the nerves, but in turn it's involving the muscles because they develop that tremor. And within that tremor becomes a lot of muscle rigidity, because if you were shaking your side of the body or the arm continually, it's going to tend to get quite rigid quite quickly. Now, again, it's not something I had an anticipation to pursue as someone with Parkinson's, but they just wanted to try it. And within days, they had notable change to not only the rigidity, enough that he contacted me personally to say, thank you. He goes, the rigidity has diminished. It's allowing me to sleep through the night. And not just that, but my tremors themselves have reduced. Now, that's not something I could have anticipated or something that we planned for, but we're continually seeing that. So we're not seeing it just as someone who sprained an ankle or someone with arthritis or sciatic issues or any of these things. Even headaches. People are finding if they put a little on the temple or at the base of the skull where the muscles attach, it's impacting that, decreasing headaches. So when we look at conditions, any type of condition dealing with pain, rigidity, it could be chronic diseases. Even another sports injury comes to mind was a young girl who does a lot of sports, right, and tore her Achilles tendon, just a complete rupture, which is a major injury and required surgery to repair. But the recovery after the surgery takes time, and she was struggling with types of throbbing pain that was coming along with the speeding of the recovery. But once she started using DMSO, the result was, you could see the expression in her face change within seconds. She goes, the throbbing pain has decreased. She goes, it's not swollen, the inflammation has gone down. It's truly been a remarkable product for her in that aspect, and speed of recovery and getting back to being involved in sports. So when we look at all of these things, any form of pain, we keep getting amazed by what we see as far as the results go, in different types of conditions as well.
If that's so good there, and that's a herb, there's no chemical in it, eh?
Well, it's not really classified a herb, it's classified a natural or organic substance.
So
okay?
then you could spray that in your mouth then?
I cannot legally advise you to do that, but in reality, there's nothing in there that would harm you, okay?
Yes.
So, I mean, it's not something we have to keep locked away from kids or anybody along that line, but, use it responsibly. And this is what we tell people, is use it responsibly. I do know of individuals, and you'll find in research where people do use DMSO for different conditions, stopping strokes, things like this. You'll see stuff online, a lot of research. We don't encourage that type of use of it, but there is nothing that's toxic within that product.
Yes, this product is now available at our clinic, and because of medicines, right here, just got a few minutes left, what are some of the side effects of that?
Interestingly enough, because it's so rich in sulfur, it smells like garlic, or garlic smells like sulfur, however you want to look at that. But there is a garlic odor to DMSO, and as soon as you put it on, you'll actually taste it, or garlic oysters is a common term that's used. But with the formulation we developed, it's eliminated the side effects that come with the use of DMSO. We have a few other ingredients in there to balance that all out. Some of the times people will develop If you use DMSO by itself, redness of the skin, itchiness, these types of things. In our formulation, we've eliminated that. We've added some of the ingredients, natural vegetable glycerin, which helps with the skin, a little bit of peppermint essential oil, which is, again, helpful for muscles and arthritic joints, things along that line, which eliminates the garlic odor, the garlic taste. And the nice thing is some magnesium chloride, which is as well going to be taken right into the muscles, because DMSO is not only a penetrant, it's also a carrier. So it'll carry that right into the muscle where it's needed and also help them to relax.
So you can spray that anywhere you're sore.
Spray it anywhere you're sore.
So if you're sore in the kitchen, you'd spray it there.
You spray it there. Funny you say kitchen. I've used it on some personal burns, right? You touch a toaster, and you'll see even in literature that burn clinics have been using DMSO because it hydrates those cells again. And yeah, no blisters, no nothing, and the burn heals very quickly.
It's too bad we've run out of time, and we'll have to have you back on our show again.
Well, thank you.
And what an amazing product I found for pain, and especially even if your hands just get stiff. Yeah. It takes all the stiffness out of your hands and joints, and amazing. So we now have that available for people to buy. It's about $40 a bottle. 300 sprays last quite a while. So if you have pain, you'll do anything to get rid of it. So just before I go, a guy was here 2 days ago, and he said he had pain all over, nobody can fix it. I said, don't say nobody. I'll just give you one little capsule of a herb that's not legal in Canada. It's a herb.
All right.
So I give it to him, and he phoned me the next day and said, I got pain from head to toe gone. What is that? Is that a drug? No, it's a herb. But it's just because Health Canada hasn't approved it yet, it's not available. But it works like that, gets your muscles and along the lines of your product there. Every product has a beautiful identification. We will see you again, and we'll have you back again.
Thank you.
Thank you. This is Terry Bell from Herb Doc saying good night. Okay.
I'll leave that one in.
Okay. You could.